We had to have a place, get a cook,
Mm.
get started. We started, our first day was on July 11th, 2023. And we were surprised. We kind of thought, well, maybe we're going to feed 30 or 40 people. From the beginning, we were feeding 70 people on average a week.
Hello, one and all, and welcome to an incredibly special National Rural Health Day episode of the Rural Impact, where, as you know, we work hard to connect the dots between policy and rural everything. I'm Michelle Rathman, and I continue to be so grateful that you joined us, especially because we know that you have many options for the podcast you want to listen to. And so, again, we're just so thankful that you found ours, that you subscribe to us, that you share, and that you support the important work of advocacy for policies that ensure rural vitality. Now, as I mentioned, today is National Rural Health Day. It's always the third Thursday of November. And this is a movement that I've had the privilege of working on with the National Organization of State Offices of Rural Health for over 8 years. And I was so proud of that service to that organization. And I continue to support and believe in National Rural Health Day because I think it's essential for the future of rural health, of course, position I know that millions of you out there share. And that includes the Oregon Office of Rural Health, which is the organization we went on the road for to bring you this episode. With that, let me tell you a little bit about what you're in for. Now, to amplify the work of rural health, the power of rural, and the importance of federal partnerships to address social drivers of health, we traveled to Bend, Oregon, where I moderated a panel discussion for the 41st Annual Oregon Rural Health Conference. And as you'll hear, we had a wide ranging discussion about the social drivers of health and supporting policy, the big P word, policy, fueled investments in food, nutrition, housing, and access to essential healthcare services. My panelists, I was so elated and really honored to be joined by Priya Helweg, and Priya is the acting regional director and executive officer for the Region 10 Office of Intergovernmental and External Affairs, Office of the Secretary, U.S. Department of Health and Human Services. We were also joined by, and I really have enjoyed speaking with him, that is Chad Davis Montgomery, Director of Supplemental Nutrition Division, Western Region, Food and Nutrition Service with the United States Department of Agriculture, that's USDA for short, and as well as Andrew Lofton. And Andrew is Regional Administrator, Region 10, U.S. Department of Housing and Urban Development. And this episode, aside from those federal partners and those representing those agencies on the ground in Oregon and the region that they serve, we also had a conversation with Sarah Anderson. And Sarah is the Director of Field Services at the Oregon Office of Rural Health, as well as Jennifer Little. And Jennifer has a really interesting job. She is the Director of Public Health for the Klamath County region. And also, we spoke with, at the very end of this episode, you're going to hear a beautiful story from a man named Jerry Conklin. And Jerry is the chairman of the board for South Morrow County Senior Matters. And you're going to hear so much about the work that they're doing to feed people and nourish them as well. And then we hear from Eric Thorson. And Eric is someone I've known for a very long time. He is the CEO of Columbia Memorial Hospital located in Astoria, Oregon. I'm so proud to say that CMH was named as the National Rural Health Association Organization of the Year, and he is leading a project to build the nation's first earthquake and tsunami resilient critical access hospital out there on the Oregon coast. And so you're going to hear a little bit about that as well. This is a jam-packed episode. You might want to listen to it in two parts, but nonetheless, we hope that you do take the time to do that, because it's not just what was happening in Oregon, but these are things that you'll be able to learn and understand how these partnerships and how these policies and the funding that comes from these policies are really helping to work to improve health for communities, rural communities on the ground across these United States. So on this National Rural Health Day, the Power of Rural Day, I leave you with this invitation as you listen to these insightful conversations. And remember, in the days, weeks, and months ahead, the need the need to connect the dots between policy, rural health, social drivers of health, and investments in programs and initiatives that impact rural populations at the state and community level cannot take a back seat. The power of rural includes all hands on deck advocacy and reaching people where they are if we are going to build and strengthen cross-sector partnerships that drive sound rural policy and investments that fuel rural vitality. With that said, again, I thank you so much for joining us. Are you ready? As I said, it's a long one, but it's a good one, so let's go. The Biden-Harris administration has been quite deliberate. I've been doing this for 35 years, so I can say that in all honesty about focusing on rural health, specifically rural health equity, the word we hear so often, which is, it's linked. You can't unlink that to health disparities. HHS has had its 2022 to 2026 strategic plan, and its first goal set, which I found really inspiring in many ways, was set on protecting and strengthening equitable access to high quality and affordable health care. Can you share with us some of what's been done to achieve this goal, and in particular, the steps that HHS is taking to address inequities that are linked to health disparities and social drivers?
How much time do we have?
Couple hours. You have nowhere else to go after this, right?
Thank you. Thanks, Michelle. Thank you for inviting me. Can everyone hear me? Am I okay with this microphone? I find this a little bit awkward, so hopefully you'll forgive me. And I have that big, long title because how else would you know that I'm a Fed?
That's right.
At least we didn't run through the acronyms. I want to say that first, just let you know a little bit about kind of where I sit in the grand scheme of things. I mean, Michelle did mention that we're in the Office of the Secretary, but we are in the regional office. So Region 10 is Idaho, Alaska, Oregon, and Washington, and 272 federally recognized tribes. And that's really, really important because in order to understand what's happening on the ground, that is what shapes policy often. And our work really is driven by that belief that everyone deserves access to affordable, quality healthcare, but we don't know what that is unless we can be, the eyes and ears of the administration on the ground. Mm-hmm. So I just wanted to put, give that caveat. And we also have 12 of our HHS operating and staffing divisions leadership in our regional office. So SAMHSA, HRSA, CMS, those acronyms in our office so that they also are monitoring how our programs are happening on the ground. If I forget the question, you'll have to remind me.
No, that's okay.
But there has been a lot has happened since President Biden basically committed to supporting underserved communities and equity and directed us to have a whole government approach to that, to addressing those inequities. And equity and affordability and accessibility are really our guiding principles under Secretary Becerra's leadership. Mm-hmm. And we use those kind of as our guiding star. You all know, actually, you have a whole conference on a lot of things that are our initiatives around workforce and grants and policies and waivers, all of those things. So you don't need to hear those from me because you are steeped in it. So what I thought I would talk a little bit about would be our strategy. Mm-hmm. And the importance of understanding what happens in rural communities and look at the kind of the key steps to engaging meaningfully with those communities. I mean, after all, rural communities are not just urban communities spread out, mm-hmm. right? They're not just the same things. They're also pretty diverse. In Region 10, we are separated by farmland, high desert, mountains. In Alaska, you can't get from one place to another without a plane or a boat. And these things, the diversity that we see in those communities require, and I think deserve, diverse solutions, mm-hmm. and diverse solutions that are informed by the people on the ground. So that is what we do in the regional office. I can talk a little bit more about some of the other things that we have around our programs, but the other thing I'd like to say is that rural communities are kind of a barometer too that help guide us. For example, uninsurance rates are lower, a lot lower since the passage of the Affordable Care Act. However, in rural communities, while they are lower, they're still 1% to 2% percentage points higher than urban communities. And so that tells us that we need to do more. So we can't just sit on our successes. We really have to take everyone along.
You know, you and I had an opportunity to touch base yesterday, and I wonder if, before we move on, I didn't know this, and I learned so much. I like being this age because you can be a sponge, and you say, instead of saying, I know everything, you go, wow, I didn't know that. I didn't know about the Office of Civil Rights. And when we're talking about health equity, I think we'd be remiss if we didn't connect those dots. So would you mind just touching on that for a moment, and what that's about, and what was the policy, what was the influence behind putting more of an emphasis on civil rights as it pertains to health equity?
Sure, and I have to find my sheet because I am not a lawyer. But the Office of Civil Rights, and I think this is one of the strategies for addressing disparities and improving equity, is to to codify things that make it sustainable, that give people a leg to stand on when they are advocating for their rights. So this year, the Office of Civil Rights rewrote the HIPAA privacy rules to include bolstering more rules on around reproductive health so that folks have better privacy. They also, let me get this right. We also wrote the final rule around Section 504, which clarifies and strengthens civil rights protections for people with disabilities, addressing discrimination in medical treatment, adds enforcement standards for accessible medical diagnostic equipment, and ensures accessible web content and mobile apps. So what that means is that we're bringing it into the modern age. It hadn't been revised since like the 1970s, and it makes it so that folks who are trying to get access to mammograms, for example, if they're in a wheelchair, there has to be a way for them to get to that equipment, right? You can't discriminate against folks when they're accessing healthcare. If you're using web-based things or iPads to enroll people, and an elder walks in and you hand them an iPad and don't give them any assistance, this is considered discrimination. Sure. So we're bringing it into the modern age, and I think what's really important about that is that it's sustainable. It's not going to stop after November or January. This is really modernizing those rules. And the other one we did was Section 1557, the non-discrimination provision that prohibits discrimination on the basis of race, color, national origin, sex, age, disability in any of the health programs that are funded by the federal government. We added folks with HIV/AIDS. We added LGBTQ+. So we have added folks in rural communities are also a part of that, so that those folks cannot be discriminated against, and that was improving the Affordable Care Act, Section 1557. So you can tell I'm not a lawyer. I'm more about the kind of strategy around it.
But it's excellent information. I think it can be easy for that to be lost on us, of how essential. We've had several conversations about, listen, this is all born out of policy and priorities. Chad, I want to turn over to you because USDA is a very large agency that covers a lot of territory, and many of you might be familiar with the USDA Rural Development and their community facilities programs and things of that nature. So talk to us, Chad, about your work, your programs, and the influence and the impact that it's having on rural communities across the communities that you serve.
Yeah, thank you, Michelle. I want to, just like Priya, just situate where I sit as well. Like you said, USDA, which is a department, is huge and has many agencies underneath it. Food and Nutrition Services, one. And even within our agency, we have 16 different federal programs we administer, which is a tremendous amount of different federal programs. So I have a lot to talk about today, so I'll try to keep it brief. I specifically sit in the Western region. And unlike my colleagues up on the stage, we follow a slightly different regional model than the other agencies. So I cover actually Region 10 and Region 9, essentially, all of the West Coast. So I get Alaska, California, Oregon, Washington, Idaho, Nevada, as well as our Pacific partners, Hawaii and the 3 Pacific territories, and 400 plus federally recognized tribes that are in our region. So it's a vast amount of work that we're doing. And like you said, I'm sure many people in this room know that poor nutrition is a leading cause of illness in the United States. And through our 16 programs at FNS, we touch 1 in 4 Americans on the average in a year through our existing programs. We know that poor nutrition is associated with more than 500,000 deaths per year. It's linked with increased risk of chronic disease like obesity, diabetes, heart disease, as well as broader societal impacts like lower productivity, weakened military readiness, and rising healthcare costs. I know I'm preaching to the choir here. And in fact, around 85% of current healthcare spending is related to diet-related chronic disease management. And we know that even with that environment, many Americans are struggling to put any sort of food on their table. A sister agency, like you said, our department's big. The Economic Research Service, ERS, publishes an annual report every year, and they just published last month the Household Food Security in the United States in 2023 report. And in that report, the latest data shows that 13.5%, or nearly 18 million US households, were food insecure at some point in 2023. Specific to Oregon, Oregon's doing a little bit better than the national average. The prevalence of food insecurity in Oregon is 12.8%, with 5.8% of Oregons experiencing a very low food security. So we know that communities, underserved communities, just like rural communities, experience higher rates of food insecurity and chronic disease. These are real issues. So USDA's, especially like you said, under the Biden-Harris administration, but for a long time, we've enjoyed bipartisan support. Our work has been working to advance our existing programs. They're some of the most well-researched programs that we have in the federal government. We know they work, but we also know we're not reaching everyone that can be served by them and that are eligible to be served by them. So we've been doing a tremendous amount of work at USDA over the last several years to really advance and make rule policy changes and launch new programs or new initiatives to help reach more people, make our programs simpler to administer, and help increase the choices and meet Americans where they are so that we can help them with their food security. And what our Secretary Vilsack, has really done is move the conversation beyond just food security into a new term that we're using, nutrition security. That is, that it's not just caloric intake that matters, it's whether or not it's nutritious and healthy. How does it affect the human body, but also how does it affect the environment and the communities that it's grown in and produced in, and how does it get to our tables, et cetera. So these are all things that we are trying to work on at the USDA. I don't know if you want me to talk a little bit about our work that we're doing.
I do, because, a show of hands, let me ask you, how many of you work in a community that no longer has a full-service grocery store? Very few. I tell you, I travel places, and I was just in a place in Colorado. They don't have a grocery store. There is no fresh food in the grocery store. And the hospital and the community, they look at them and say, how can you help? And so one of the things that you and I talked about, Chad, was, just the SNAP and WIC programs and the summer nutrition programs. Many of you are familiar with the WIC program, but we talked a little bit about how WIC is saying we can do further modification of this to make sure that our rigid policy doesn't stand in the way of access.
Yeah.
So talk about that just
Yeah, absolutely. So like you said, we have 16 programs. The 3 biggest that most people know is SNAP, of course. And even there, we're making advancements. There's not a lot of room to really modify that program. Congress also does a lot of writing of the requirements themselves. But even in that program, we've been expanding online shopping, to your point. And online shopping in SNAP is now available in all 50 states. We have over 200 retailers that are actually able to deliver SNAP benefits through online shopping. And so we've been making incredible amounts of strides there to try to, it's not the only tool, but we believe it's one of the tools to address food deserts. It also, though, addresses stigma and discrimination that many of our participants face when using their benefits in person in the store. So we're also finding that that is helping with increasing participation and redemption of benefits. Because it's one thing to get people to participate in our programs, but we actually have data that shows not everyone that participates uses all of the benefits that they're eligible for. And part of that is due to stigma and challenges and barriers that people face at the store and actually accessing their benefits. Like you said, in WIC, our third largest program, public health program of all 16 programs, it's our most public health program, perhaps the most well-famous public health program in this country. 50 years the program has existed this year. I'm incredibly passionate about this program in particular. And we know WIC works. We have more body of research on this program than, again, like most other federal programs. Every aspect of the program has been researched. We know it works, and we're only reaching about 55% of eligible population in the United States. So we have a long way to still go. The pandemic provided us an opportunity. Oftentimes, crisis can give us silver linings in government, right? Especially it's where we learn the most and we advance some of our work. And so it kind of created a crisis for us. And so together with the administration, with the agency, and with Congress's support, we've been investing over the last 3 years in significantly modernizing WIC. And one of the first places that we've done that, partly because of the pandemic forced us to, and now we're working to permanize this and pilot new models for delivering WIC. Prior to the pandemic, there was a physical presence requirement. It's actually a federal reg and statute that you have to come into a WIC clinic to be certified and eligible for WIC services to be able to get your benefit. And we know that impacts rural communities, but we also know that impacts just busy parents with multiple kids and trying to go to 2 to 3 jobs, and transportation barriers and housing barriers. So we have piloted remote services in WIC so that now it is no longer a requirement to physically come into a clinic. Now, this is met with mixed bag. A lot of our longstanding WIC practitioners really value the in-person services, but we're now able to have additional tools in the toolbox to meet families where they are, so that if a family doesn't want to come into a clinic, they can now get services through telehealth, through remote services. They never have to step into a clinic if they don't want to, and that has pluses and minuses, but we're reaching more. We're already seeing this year alone an increase in WIC participation at rates that are higher than it has been in over 20 years. We're reaching more people finally that want and can benefit from that program through remote services. So that's one of many ways. And also the other thing I should mention in WIC, two other big policy things we're doing in WIC is, in addition to the remote services, we're also piloting online shopping in WIC. So SNAP always usually gets to go first, and then we kind of come behind in WIC. And in WIC, we're now piloting in 8 different states online shopping pilots that eventually the goal is to be able to roll those out to the entire nation and be able to pilot. It is a lot more complicated in WIC because it's not just a dollar amount. We're actually, the benefit is actual specific food items. So the technology, which I've learned a lot about, is way more complicated to figure out. So we're piloting that, and that's really exciting. Not yet in Oregon, but your neighbor just up north, Washington, is one of the states piloting, and they're piloting actually with Massachusetts, with Walmart, which, if that comes on, is a huge retailer. So that would reach a lot of WIC participants. And the last thing I'll mention in WIC modernization, there's lots that we're doing in WIC, but the other thing that we're doing, maybe specific to this audience and to rural communities, is we're also trying to make it easier to get people on WIC right from the get-go, right? So I probably am not the expert here, but if you are pregnant in a hospital, the last thing that you want to be dealing with is government paperwork to get benefits for your newborn infant. And so we're really trying to roll out policy and remove barriers in policy to data matching and automatic enrollment. And this is really where healthcare comes in. So we're really encouraging our state agencies to partner with healthcare in their state and with health providers in their state to really create unique collaborative partnerships to really drive automatic enrollment so that we can get more people that need that program enrolled on that
Excellent.
program.
And your summer nutrition program, I really love the way that there's been modifications to that versus having to, you can go to no questions asked, right?
Yes. So, and then I know we'll want to move on. So I'll just mention 2 things. You interviewed our now Deputy Undersecretary, Cindy Long, on our summer program. So this is really exciting, and it also impacts rural Oregons, and everyone in this country. 2 particularly exciting things there. One is it's our 16th program, and we just launched this year, and it's unusual to get a new permanent federal program. So it's our 16th permanent program.
Miracles can happen.
Miracles can happen, and it's a summer EBT program, or what we're calling Sunbucks. It's really addressing that summer nutrition meal gap that we know exists in the summertime, and it allows for an EBT benefit, so a dollar amount that's issued on an EBT card per child that's eligible in the summer months so that they can get benefits in their state and wherever they want to. But the other, sometimes not talked about, and I think in really exciting policy change, and this was a policy change that we did, is our summer meal program used to have a congregate requirement, and it still does in many parts of the country. So it was meant to be that kids come together at like a park and get the grab-and-go meals that you were mentioning.
Right.
But we know that wasn't working in rural communities because it's hard to find a location that will reach enough people when people are further spread out, right? And so with the authority that we had, we were able to roll out a permanent option in hard-to-reach rural communities that is now allows for home delivery and non-congregate delivery of that program so that we can get that program to people and meet them where they are. So really exciting work that we're doing. I have
Super
pages and
significant.
pages of notes, but I'll stop there for now.
And I have to say, it is a very easy to navigate website too. And we'll talk about that, and I'll share a little bit about how you can tap into all these resources really easy in one site. Andrew, now you're in the hot seat because there is not a single, I told you in the time that your generous time that you gave me in preparing for this, there is not a single rural hospital that I work with not grappling with housing issues, whether it be housing for your own staff. It's challenging to recruit somebody if you got no place for them to live. Challenging for communities, for growing populations, and then healthy housing as well. But talk to us a little bit about what HUD is doing. People hear Department of Housing and Urban Development, and they go, we have rural's left out. That's not true. It's really amazing the work that you're doing. So talk to us about HUD and the work that you're doing to address the inventory, the affordability of housing, and some of the solutions that we can look forward to from your office.
Thank you, Michelle, for that introduction to the question, and good afternoon, everyone, and thanks for the invitation. My name's Andrew Lofton, and like my colleagues, I'll give you a little bit of where I sit in the totem pole. So I'm the regional administrator for HUD in Region 10, which covers Oregon, Washington, Idaho, and Alaska. And I've been on the job for about 6 months, so I'm still got the training wheels on a little bit, but getting to know things a little bit better. And so to start with answering the question, I will say first and foremost that HUD's mission is to develop strong, sustainable, safe communities that have safe, decent homes to live in. And when you talk about the social determinants of health, an individual's environment in which they grow up in is one of the key components of that. And having a place to live, having a roof over your head, having a home is really at the core of that. And so in HUD, we believe that a person's future should not be dictated by their zip code. They ought to have opportunities, equitable opportunities to survive. So HUD is focused on creating communities and creating new housing opportunities for everyone. And housing is not just an issue for rural hospitals or rural communities. Housing is an issue everywhere. Everywhere I go, all of the organizations I talk with, mayors, elected officials, housing is the number one issue on everyone's mind. Mm-hmm. Housing supply, housing affordability, housing safety, housing sustainability, all of it is affecting our communities, and we see it every day. So, and specifically as it relates to rural communities, two of HUD's top priorities in their strategic plan have to do with serving underserved communities and has to do with providing increased access to housing and increased production of housing. So one of the efforts that we are department-wide involved in is identifying those opportunities throughout the country where we can help increase housing production. One of the ways that we've done that is we created a grant program called Pathways to Removing Obstacles to Housing. It's called Pro Housing Grant. And there was a grant received here in Bend, Oregon for accepting that grant. And what that grant does is gives local communities the opportunity to look at their processes, their obstacles to what is preventing housing to be built. And they can go in and create their own solutions to that. So we're providing some resources so that folks can identify obstacles that are created through normal processes and take a look at those and see how they can be changed so they can make those processes more affordable, make those processes accelerate, and hopefully bring down the cost of housing so that all of us can enjoy a decent place to live. So we've been coordinating with other federal agencies as well. So we get together with other federal agencies. In fact, the White House has created the National Rural Prosperity Policy Council. And that is a council which all federal departments get together and talk about kind of a holistic government approach. How do we approach issues around job creation, issues around infrastructure, and how do we our resources and how do we coordinate our efforts so that those can be easier applied in our local communities. And internally, the Acting Secretary Todman created an internal group such as that for HUD departments to get together and talk through how do we address those kinds of issues, including how it affects rural communities. So part of the answer to that is that we have to have a sense of urgency about the housing problem. We have to look it straight ahead, and we have to address the challenges that we see, not run away from them, but identify them and then see if we can provide local communities the opportunities to have develop their solutions to them, not solutions that we come up with, but solutions that they see on a day-to-day basis that they can implement that allow them to create the types of approaches and the type of resources that they need to create the housing that is needed in their communities.
Well, that is a lot of information we just heard from that panel, but we're not done yet. But before we go back to our discussion, we're going to connect a few more dots related to the issues you've been listening to from our panelists. So up next, we hear from Sarah Anderson, Field Service Director for the Oregon Office of Rural Health. You're going to hear a little bit of that conversation. And what I want you to know is that she and her team have boots on the ground and ears to tune in to the needs and issues that impact rural Oregonians directly. Now, I also sat down with Jennifer Little, Director of Public Health for Klamath County, and she talks to us about the essential work of local health departments and their strategies to ensure that county, state, and federal officials invest in public health and all that entails. We are here at the 41st Annual Oregon Rural Health Conference, and there is just so much activity going on here today. We found a quiet spot so we could have some one-on-one time with Sarah Anderson with the Office of Rural Health. Sarah, thank you for joining us.
Thank you so much for having me.
First of all, Sarah, why don't you share with our listeners a little bit about your role? I know you wear a lot of hats, but what is your official title and your focus of your work?
Sure. Yes, my title is the Director of Field Services for the Oregon Office of Rural Health. And so I oversee our team who provide technical assistance, programming, and grant opportunities for critical access hospitals, rural health clinics, rural public health, and community-based organizations.
And like so many other states, you have several, much of your state is rural, as I understand it. And so you cover a very large swath of land here. Tell us a little bit about the landscape of rural health in the state, just in terms of maybe the makeup of the kind of hospitals that you have that are covering this and the population size, if you can provide that as well.
Yeah, you bet. So Oregon is very large. Driving from one end of the state to the other end of the state takes about 7 hours. We have 32 counties in the state of Oregon, and there are 33% of our population lives in rural. And to give a little bit of idea of what that looks like, so we're here in Bend right now, which is the high desert. And so there's a mountain kind of in our backyard here. The Cascade Mountain Range runs from north to south through kind of the western side, central to western side of the state. And then there's a coastal range, and then there's another range at the border between Idaho and Oregon. And so there's treacherous terrain throughout, and most of the population, the other third of the population, is really kind of centralized along the I-5 corridor in Portland and Salem. And so the rest of Oregon, if you can imagine that, is definitely rural and frontier or remote.
I've driven it. So I recognize that there's some stark contrast in just the topography. And with that, also the challenges, because you've got places like Astoria, Oregon, where it's just a magnet for tourism, and other places such as Heppner, Oregon, which is, very challenging to get to. And also their health organizations are across the state. They all look a little bit different. Let's talk a little bit about some of the challenges. I know one of the things that you all do that I find just really admirable is that you do kind of a listening tour. And as I understand it, you do this so that you can understand the challenges. So I think opportunities are born out of understanding the challenges. So can you give our listeners, we've done this in Nebraska and their challenges are different than yours. What are some of the biggest challenges that your rural health organizations are facing today? Now we're nearing the end of the year 2024.
Yeah, absolutely. We've just finished rural listening sessions in April and May of 2024. So we're very fresh off of those tours. We went to 6 different regions throughout Oregon. And those regions we asked to develop the agenda for items that we were going to discuss that were of concern. Every single region talked about workforce recruitment and retention issues, which I think is prevalent among,
universal.
Most, yeah, exactly. But then we talked about access to care for patients and what that looked like from our communities was really transportation issues, getting to a doctor, getting to an appointment, language issues. We have a really high Latinx population, Spanish-speaking population in many of our rural communities in Oregon, and it's really difficult to get certified to be a medical interpreter or a healthcare interpreter. So that's a challenge. And then dialects, different dialects are a challenge. We also talked a lot about patient supports, and what that boiled down to was social drivers of health for patients. A lot of our clinics and hospitals are starting to incorporate community health workers to help connect patients with, resources to address their social needs. But we need more, and we also need to have better payment structures, both on the Medicaid and Medicare side, in order for those sorts of programs to open up more broadly and for them to be sustainable across the state and across the country. And the last final piece I'll mention is finances for the critical access hospitals themselves, as well as public health and the rural health clinics as being real challenges.
We are at the 41st Annual Oregon Rural Health Conference, and I would like to have our guest introduce herself and her name, title, and the organization you're with.
I'm Jennifer Little. I'm the Director of Klamath County Public Health. I've been in the role for about 6 years.
6 years. Well, welcome.
Thank
We're
you.
so glad to have you here. Okay, so we are here and focus on many, many subjects, but first and foremost, could you just kind of give us a snapshot of public health in your county, and maybe we can take that and expand that to a broader lens of the state, because I know every place is different, but I would imagine your struggles and your challenges look kind of similar on the same page.
There's some similarities, but it's really quite amazing to see the diversity in how we just run our departments. And so for those who don't know, public health has certain statutory obligations of things that we must do.
Okay.
And there are other programs that are additional, very important things. They may have sustainable funding, they may not have sustainable funding. But something that we're looking at a lot and have been for many years is policy, systems, and environmental change. And also we're looking at upstream prevention. We've seen how there's been neglect, panic, repeat, neglect, panic, repeat.
My, yes.
Right? And so public health professionals are trying to come in and say, we don't have to do that. Through policy, through investment, through prevention, we can set things up in the community to really create a culture of health, help a community. That doesn't mean everybody's going to have everything.
That's
right. But so that's what we work on just in general. And in Klamath, we're unique because we are a rural community, but we're one of the larger rural communities. So we may have more resources than some of our frontier communities.
And you have plenty of those in the state.
We have plenty of those in the state. Half of the state is frontier. And so we work really hard to work with both our local elected officials at the city council, our county commissioners who are our governing body, as well as working either through them or through the coalition of local health officials to go up to our state legislators and sometimes even our national legislators to advocate for change, whether it be incremental or sweeping change.
My thanks to Sarah and Jennifer for sharing their wisdom. What you just heard was a very small piece of our conversation with them, and we'll be sharing more of these conversations with you on our YouTube channel, so be sure to follow us there as well. Okay, let's get back to our panel. Priya, you and I talked yesterday, and it just gave me an aha moment because when I was doing my research for this other project, I came across the Food as Medicine program, which is not housed out of USDA. But what a unique opportunity to say, yeah, we're watching, and you, Chad, you told me you're watching it. Priya, talk to us about, because it's a great way to cross-sector collaboration. Talk to us about the Food as Medicine program and, maybe not just through a rural lens, but what is the premise of it? What does it do? How does it work? How do the folks here understand how to kind of grow a program such as that in their own community?
Wow. Yes. We're really exciting. And it's a good thing to mention right now because we just launched the Food as Medicine toolkit. It's a virtual toolkit that has kind of foundational materials that would help grow a program. It includes data. Lots and lots of data because nothing changes without data. And it's a resource hub. We also have a section for promising practices. And it provides kind of an analytic framework for measuring and making food is medicine a priority. So it's based on the National Strategy on Hunger, Nutrition, and Health. And it's based on the 2022, I guess most federal agencies actually came together to develop this strategy and on nutrition and chronic disease and food insecurities and to figure out what to do about that. I think most of the time we're finding that our programs do overlap quite a bit. We can't do one without the other. So, and we should go sort of hand in hand rather than have competing programs. So I really like this cross-collaboration piece. We also know that innovation on the ground is what eventually changes a lot of things for our real people on the ground. And I would say that in Oregon, the understanding that food is linked to to health, of how important it is that people get proper nutrition to maintain their health is an innovative idea. It shouldn't be innovative, but it is. And so I applaud you all for doing that on the ground as well.
I think about, I hear this so often, and I would imagine there'll be some head nodding here. The programs are great, and the grants are wonderful. I think so many of the rural health organizations I work with struggle with capacity and accessing programs. Great, there's a grant. We don't have a grant writer. And great, there's a grant, but we have a lot of conditions by which we have to make sure that we are adhering to whatever the grant prescribes. Can you each kind of talk to us a little bit about how your agencies are working to build capacity? Because you're not working, Chad, you're not working directly with a critical access hospital, but how are each of your agencies really working to build that capacity that ultimately, the goal is to create sustainability? Down the line. Who wants to do it first?
Thank you for that question, because it's one that has come up very directly in our conversations internally. And one of the things that HUD will be launching this fall is some additional technical assistance specifically for rural communities, for smaller communities. We'll have the resources associated with what's called the Distressed Cities Technical Assistance Program. And that's a program that small communities under 50,000 can apply for the type of technical assistance that they need if they want, whether it's capacity building, whether it's help with a specific project approach, project management. We'll have some resources available that we can reach out to communities and provide them the kinds of support that they need for their particular problem that they're experiencing then. So we're excited about that. We are going to be launching that later this fall, and it'll be applications available for our communities that are under 50,000 in population are eligible to apply for it.
Awesome. Chad, what say you?
Yeah, I have a couple thoughts on this. I think if you ask our state partners, they might say that we are not increasing their capacity and we keep throwing more and more initiatives and policy at them. But joking aside, I would actually say I think a couple things come to mind. One I want to mention is a specific grant that we rolled out in the last couple of years in one of our programs that I didn't mention. I mentioned we have 16 programs. SNAP, WIC, and Child Nutrition are really well known. But in addition, we also have food distribution programs, and you're probably familiar with it, but just not the name. So the Emergency Food Assistance Program, or TFAP, that's primarily our way at USDA of getting food, actual food, to food banks. It's administered through states and down to food banks and emergency feeding entities. And this may be very applicable in rural communities because we know that this is often the lifeline around nutrition security in rural communities. Food banks are at the center. Emergency feeding entities are often at the center of a community and really know all of our programs and what's being served well and where the gaps are. And so I want to get this right, in 2022 and 2023, we rolled out a TFAP, which is the name of the program, Reach and Resiliency Grant Funding. And specifically here in Oregon, we gave $1.7 million, and these projects are continuing through 2025. And specifically, these projects establish new food pantry sites in underserved areas, expand storage capacity in rural areas, fund equipment upgrades at warehouses that reach underserved communities, and they increase food access through mobile pantry and distributions in rural and low-income communities. So that's one really concrete way. I could also mention in our child nutrition programs that we just launched the Healthy Meals Initiative, which is really trying to provide additional resources and capacity, technical assistance. I'm sure many of you have heard that term because you probably work with federal partners, but I always like to explain technical assistance as the federal government's fancy way of saying help, like education and help on how our programs work and how to access them. So that's really what we mean by that. And so we've been in our child nutrition programs also providing increased efforts around that for school nutrition professionals, the folks in cafeterias at schools, to help them change the equipment and the way that they do meal preparation and the education around how they can do more scratch cooking, which we know results in better and more nutritious meals, things like that. So we're really trying to increase the capacity of our existing network and partners to deliver our programs in that way. But two out-of-the-box ideas that I just wanted to throw out as sort of work we're doing to increase our capacity and increase the capacity of rural communities to actually access and serve our programs is through workforce development as well, much like many other agencies. We're really working both internal at FNS, but also with our state partners and our local partners that are delivering our programs to diversify our workforce so it looks more and more like the people that we're trying to serve and more like all of America. And I actually will say this is another silver lining of sort of the pandemic and workforce changes. We now have the ability to hire staff throughout our region, and that's really changing the folks and the thinking, the ideas that are being brainstormed around policy, because when we have people with lived experiences from rural communities on our teams, that changes the conversation inside the agency.
Absolutely.
That's changing the conversation at state agencies and local agencies as well. And then the final thing I'll say is around technical assistance. And this has really been driven by this current administration in particular. Oftentimes, I'll just speak for myself and my agency, we will roll out new programs and new initiatives, and we depend on our existing partners to deliver that. And then we'll say, come and ask us if you have any technical assistance needs, and we're here to help you. But we don't always go sort of that extra mile to really think about how can we deliver. We have a bunch of staff and knowledge at the agency. How can we access that and reduce effort between us and our state partners and our local partners? So we've really been driving more and more with Modern World of national online technical assistance, webinars, trainings, things that we're doing at our level, at the federal level, to deliver straight to our states and to local partners to help people access our programs or learn about really promising practices or best practices that are happening in one state. Hey, this is really happening great here. How can we help you make it work in this community as well? So with that regard, in Western region, the region I work in, we've really been targeting rural communities and our tribal partners and our tribal communities. And we've been really looking at ways that we can model and demonstrate best practices that can work across all of our programs. So those are just some examples.
And
that we're
with
doing.
that, how do our community health centers, how do our rural health clinics, our critical access hospitals, because you all are the people who are right, you have the captive audience, and how do you provide, or what kind of technical assistance can you provide to make sure that these important toolkits are in the hands, maybe through the State Office of Rural Health and then out to the clinics? Because if it's not reaching the people where they live, where they love, where they work, where they play, then it's just another government program that you add to the mix.
Yeah, absolutely. And then I want to let Priya answer as well. But I would say two things. I mean, I think we've talked about, I'm going to make sure we have some contacts for the podcast, and I can add up on the conference website as well. You know, in our case, all of our programs are administered through state agencies and then local partners. So I would want to drive people to the state partners here in the state that are doing things. But we're always happy at the regional office. We see ourselves as conveners. And so I want to make sure, my contact information is out there, because we're always looking for partners that want to work in this space and figure out how we can connect you with other people that are already working in this space or that know our programs. And then we have been I've been traveling a lot, so we're on the road a lot more lately in this last couple of years in particular, really trying to put an effort behind that and reach. I was mentioning to some of the head colleagues here at the table, they asked if I've spoken at a health conference before, and I said, no, actually, we've not always been at these events. We've not always been in front of this audience. Nutrition has oftentimes been set aside as something different than healthcare, different than public health, right? And I think the Biden-Harris administration in particular have really driven, and really for us career vets have really driven us to say, you need to start talking to people that haven't been at the table before. We need to start talking to the communities that we haven't always partnered with. And so here we are having more conversations.
So appreciative. Okay. How do we harness the power of the technical support to build capacity that helps us bring sustainability?
And I won't say ditto. I'll drop the buzzwords, right? Workforce, technical assistance. I like the help, definitely the help component of it. And so I would just want to, we're sort of all operating under, this is a priority of President Biden's. This administration has gone full bore into these type of things, recognizing the real problem on the ground and trying to address it. And we all obviously feel that, and we also feel the leadership in that. You can kind of tell the way that we talk. I just want to add a couple of things to what was said about those initiatives around technical assistance and workforce. But additionally, piggybacking on the two final things you mentioned, one was the regional offices. And I think we should be doing a little bit more of a public outreach campaign to let you all know that we are here. I know that our Centers for Medicare and Medicaid Services, they do what they call a rural road trip. And they've done that. I worked for Senate CMS for about 16 years before I came into this role. And we would get in the car and try and go to the most remote places we could go to, where there was no Best Western on the corner. There was no, there were very, very few opportunities for luxury. And talk to hospitals, talk to providers, see what they were facing, see what their concerns were, and see if we could link them to our programs. Really, the regional office is kind of a no wrong door approach to helping you all untangle or figure out where you need to be in this behemoth that we are as an agency and as the federal government. We're also here to collect, promising practices and also, not such great stories to take back to DC to make sure that our decision makers know what's happening on the ground. Mm-hmm. Oftentimes, it's such an easy fix. Well, maybe not often, but I've seen it happen over and over again, right? Where there's this tiny little demonstration project, hospice, right? Maternal and child health. For ESRD, they wheeled a guy in, on the floor, and somebody said, that's really important. We need to include folks with this disease into Medicare. So identifying those programs is really important to us, and we do that by getting out and about. So that's really important. But I know you want to, okay.
Well, that's why. Oh, go ahead.
Well, and I also want to say that our work with the tribes is critical. We have half the tribes in the country are in Region 10. You beat me. Usually I get to say the biggest number, but our relationship with tribes, and tribes, capital R, rural, right? Mm-hmm. And rural, remote, and under-resourced, they are often the innovators, right? They're the masters of braided funding out of necessity. So we really pay attention to our tribes. We work with them, we have consultation with them, and the president passed the executive order 1142. I just said it on a call that I was on. But one of the things that does is direct us to have less administrative burden on grant funding. And the tribes are in a unique position to say this, but once you get a foot in the door, people are leaving money on the table because they can't administer the funds with all the requirements and the competing requirements, and you have to hire full-time staff just to figure it all out. And so hopefully that will gain more traction in other areas of need, because it's critical. We can't just keep leaving money on the table when you really need it.
My thanks to all those who worked with us at HHS, USDA, and HUD, and to Priya, Chad, and Andrew for coming to Bend and for providing us with a level of details that are definitely not what you hear at the kitchen table or at your local coffee spot. But nonetheless, we hope that it provided you with context to how federal agencies are, in fact, working to invest in local organizations to increase capacity and close those gaps and resources that contribute to population health. Now, for our last segment, and I do hope you'll stay with us, because you're going to hear an excerpt from two conversations that drive home the need for investments and partnerships to build rural resiliency. Now, in one case, we hear about the work of South Morrow County Senior Matters and their quest to not only feed senior members of the community, but also nourish them with resources. Finally, I'm excited to have you meet Eric Thorson, CEO of Columbia Memorial Hospital, located in Astoria, Oregon, which is on the coast and in the process of building the region's first tsunami vertical evacuation structure with safe refuge for up to 1,900 citizens and a deep pile foundation so that the facility can withstand and maintain operations during a natural disaster. For the people of Astoria, it is said that it's not a matter of if they're going to have a tsunami event, but rather when. So I do hope that you'll listen to Eric and learn about all the work that they're doing to ensure their community has a standing healthcare facility in the face of disaster. And we know, and we've seen how important that is. So here's that conversation. Hey, Jerry Conklin, Chairman of Morrow County Seniors Matter. It sure is good to see you, to have you here with us today on the Rural Impact for this wonderful Oregon Rural Health Special on National Rural Health Day.
Hi, Michelle. It's great to be with you, and thank you for the invite.
Well, I just want to tell folks, you're very welcome. I want to tell folks, I met you when I was out in Bend, and as it happens, we knew some people in common out there in Oregon, and so I'm just so grateful to have had that kind of serendipitous conversation with you the night before, and then just to learn that you're this award winner the next day, which is one of the reasons why we invited you to come on here. Jerry, why don't you tell us a little bit of a brief history of your organization, South Morrow County Seniors Matter, because in the greater context of our conversation of connecting the dots between social drivers of health and agencies. So talk to us a bit of a background about your organization and what it is that you do for the folks there in Morrow County.
Yeah, I'd love to share the story. My coworker and I, we do hospice visits around Morrow County, Gillum County, and we actually travel to small towns. And on occasion, we would go and get a senior meal for these folks, these housebound hospice patients. And other communities had a senior meal program, but Hefner did not, and it closed during COVID and we started. And so we're talking amongst ourselves and conversation on our drives about what could be done about that. And the more we conversed about it, we kind of realized that if it was going to happen, we probably were going to have to take the initiative to do it. Neither one of us really had a lot of experience. I had a little bit, not a lot. And so we just got started, and we had to ask a lot of questions and try to figure out how to do that. We ended up forming a nonprofit corporation and buying a board and seeking funds. We sought the county had some COVID relief funds, and we got some of those. A local grant funder gave us some money. We had to have a place, get a cook, get started. We started, our first day was on July 11th, 2023. And we were surprised. We kind of thought, well, maybe we're going to feed 30 or 40 people. From the beginning, we were feeding 70 people on average a week.
Wow.
So the response was pretty amazing. And of course, we also, some other things that we did, which unique to what we were doing, is we decided we were going to have speakers that came because we wanted to connect people. It was more than just feeding seniors a meal. It was about connecting them with each other, of course, but also to resources. And so we would invite speakers to come at our senior lunch. It's something we've been doing. We've had over 50 by now. And another thing that we did, which was unique to us, is we saw volunteers. We ended up having volunteers from every church in Hefner, plus Hefner High School, which we have over 100 volunteers on a rotating
Wow.
basis that come. Really amazing. That was a component that we didn't really think about in the beginning, was this whole community outreach to seniors. It's just been incredible that way. So the history of it, that's kind of how that happened. And I think it kind of went beyond what any of us would have imagined back in the beginning of what might happen with that.
Hey, Eric Thorson, CEO of Columbia Memorial Hospital in beautiful Astoria, Oregon. Thank you for joining us here on the Rural Impact. We're really glad to have you here.
Well, thanks for the invitation. How are you this morning?
Very good. We have a lot to talk about. I work with a lot of rural hospitals where a project of your size would be completely, that would be a total fantasy world. We are not talking about a $40 million facility. We are not talking about a $50 million facility. We are talking about a $300+ million facility. And another really interesting thing about this program, when we tie it back to policy, is that you participated in a rather competitive grant application process through FEMA. Talk to us about where some of the funding is coming from and how you were able to be awarded. And you kind of go through those details for us, will you please?
Sure. The program that we participated in was FEMA's BRIC grant, which is Building Resiliency in Communities program. It took us, honestly, 2 rounds before we were, I can't say that we've been awarded yet, but we're advancing through their process. We're one of only 5 applicants in Oregon that were selected in the 2023 round of applications. So initially in 2022, we applied and we did not advance. So we learned some lessons through that about, what things were really important to highlight in a BRIC grant application. We got some help from a few consultants to really help refine our application, make our story stronger. And then we're successful in the 2023 round of basically receiving a $20 million FEMA BRIC grant, which will help offset, all of the resiliency components that we're building into our new facility. The BRIC grant does have a local match requirement. So FEMA funds 70% of the $20 million, and then you need a 30% local match to receive the full $20 million grant that we have.
Yeah, and I think another really interesting, exciting part of your story and heartwarming to me is that you've had so many community members come forward and staff come forward and make rather sizable donations because, apparently this is important to other folks as well. Eric, I know that you have been very active and advocating for your project with your state and your federal lawmakers. And, folks who listen to this podcast know how important I believe it is for those of you who are working on the ground to become advocates and really bend the ears of those who hold the purse strings. So from one CEO to other CEOs we have listening here and board members, kind of what is your advocacy toolkit? How do you suggest others in your shoes to say, hey, we need investments that are beyond our reach to advocate for yourselves? What's the story you tell them as to why they should be paying attention?
Yeah, I think that's a great question. And I don't know that we have any necessarily silver bullet to give to people. But I can tell you what I believe has helped us advance those efforts with our elected officials, local officials, is, having those relationships in place ahead of time. It doesn't, I don't think, work very well if you don't know your elected officials and you show up on the first or second visit and say, hey, would you help me try to secure, a $6 million, match obligation that I have? We have spent years, engaging our local, state, and federally elected officials in our project. So, this has not been something that we decided to do overnight. I mean, this project has been going on, the planning around this project really since 2018. So during that time, we've invited all of those folks into our design, our thought process, our needs around budget, how expensive this project truly is. And, one thing that I think it's worth noting of our organization, we're not a tax district. We're a private, not-for-profit organization. We don't have an affiliation with, like an affiliation in a true sense of the word with another organization. We have great collaboration with our local university, but we're on our own here, and we're investing $300 million on our own. And I think that educating our local officials, educating anyone who will listen about what our kind of plight is, has been incredibly helpful when then it comes to, hey, we really need to raise, $6 million in local match. They already know the story.
My thanks to Eric and Jerry for their time. And before we close out, I want to express my profound gratitude for Robert Dumeg. And Robert is the director of the Oregon Office of Rural Health and a stellar national leader whose deep commitments to rural health equity is the best example of what the power of rural is, in my view. And to all those from the Office of Rural Health in Oregon who worked hard to make this episode and the event possible, I thank you so much for everything that you've done. Well, that's a wrap of this Rural Impact special National Rural Health Day episode that we recorded for you from the road. But before we go, be sure to take this opportunity to subscribe. We hope that you do, because next month and into the year of 2025, we have a renewed and urgent mission to connect the dots between policy and rural everything. Until next time, happy Thanksgiving to all. Take very good care of yourself and to everyone else around you. We will see you soon on a new episode of The Rural Impact.